most of us, I'm sure, have heard of leaky gut, okay, or intestinal permeability. There is the same in the mouth called leaky gums. So what does that mean? If your gums bleed, you've now created a way for bacteria in your mouth to get into the circulatory system, to get into the lymphatic system. And this is where they catch a free ride and end up in places like your brain or your pancreas.
Welcome to the Hunger for Change podcast. I'm Niklas Gustafson, and for over 10 years, I've been putting ancestral wisdom and holistic health to the test on myself. Today, I'm joined by Dr. Staci Whitman, a board-certified functional pediatric dentist who is here to debunk everything you think you know about your mouth. From cavities to toothpaste to breathing and sleep, she connects oral health to your brain, your heart, and even your hormones. Staci, thank you so much for joining me. I'm so excited. It's an honor to have you on the show. Well,
Thank you, Nicholas. I'm excited to share some things about oral health with your audience. I hope it's helpful.
it's going to be very helpful. So first of all, a question that I usually ask my guests, what does health mean to you?
Health means to me living the best version of yourself. Waking up every day feeling fulfilled, feeling vibrant, um, and feeling balanced and at peace. So that can be different for everyone. What gets you out of bed every day, what makes you feel good, what diet. We're not one size fits all, and that's what can be challenging with some of the recommendations that we see online is that they don't work for every person. But everyone has the best version of themselves out there. And so I think just constantly trying to chip away and work toward that goal is the best version for me. Just feeling great in your body and mind and spirit and soul every day.
Is modern medicine still underestimating how deeply oral health influences our heart, our brain, and our overall longevity?
Absolutely, yes. Unfortunately, modern dentistry is still missing the mark. We're so focused on end-stage disease and drill, fill, bill mentality, just putting out fires, that we're missing things upstream. And the importance of the oral microbiome and the oral systemic connection cannot be overemphasized. We know you cannot be healthy systemically without an optimized oral microbiome and optimized oral health. And there's so much more to it than just brushing and flossing. We really need to be focusing on things at a much deeper level and taking a root cause approach.
Mm. So why do so many people still see oral health as separate from our full body?
Yeah, I blame the way this specialties divided out. Medicine went this way and dentistry went that way, and so because of that, we've been even inadvertently teaching the public that the mouth is separate from the body. And unfortunately, even the way we're trained in dental school is the mouth is separate from the body. Modern medicine, it is very compartmentalized. Think of all the specialties of medicine, and there's very little collaboration or integration about how one part of the body impacts another. And so we know we're not separate compartments. Everything influences everything else. But particularly dentistry, I think, has just gotten kind of pushed to the side as an afterthought. They're just cheap. The dentist is just something I'll do when I get to it. I do see a shift in movement, people understanding truly how impactful oral health is. It is the gateway. You open your mouth, is it healthy or is it unhealthy? That tells so much about the person inside and their systemic health too. So I think it's a training issue, it's our education, but it's also just the way the system has been set up.
So could you explain to us briefly how does the health of our mouth really impact our brain, our heart, our hormones? How do they relate to each
Yes.
other?
So there's many different ways. The oral microbiome's where we can start. So we have oral bacteria in our mouth. So just like there's the gut microbiome, there's the oral microbiome. It's the second largest microbiome in the body. It's intimately connected to the gut microbiome. It's bidirectional, so they influence one another. So if you have issues with your gut and you're not addressing your mouth, you will never achieve optimal wellness and vice versa. So they've identified up to 800 different species of bacteria, fungi, viruses, protozoa, th these species in our mouths, and they're not all friendly. So we have commensal bacteria and beneficial bacteria, but then we also have pathogenic bacteria. And having some degree of pathogenic bacteria is normal, usually around 5%. So if you oral microbiome test, you will get results, just like if you gut map or gut test. So there are oral microbiome tests now where you can test your saliva to see these ratios. But if the pathogens creep up, and certainly if they get closer to 50% and above of your, total bacteria, you are now in a state of dysbiosis or imbalanced bacteria. And those bacteria can wreak havoc on the body. So they don't just stay in the mouth, they can travel through the circulatory system. We now know they can cross the blood brain barrier and essentially impregnate and camp out in other parts of the body and essentially lead to inflammation, oxidative stress. They release toxins in the body. And so they can have these downstream impacts and effects. So, most importantly, the one that influences me the most is the connection to Alzheimer's and dementia. So, oral bacteria are being found in patients who have passed away from Alzheimer's and dementia in a very high amount, up to 94%,
Well,
of these patients have oral spirochetes in their brains, and they're not supposed to be there. They're not in the brains of healthy people, okay? We know oral pathogens can impact fertility, and sperm motility and sperm mobility and sexual health. They can lead to autoimmune disease. They're contributing to cancer. They're contributing to type 2 diabetes and obesity and mood disorders. I mean, it really goes on and on and on. So we want healthy mouths. We don't want these pathogens floating around, ending up in places they shouldn't. So we really need to be.
so we should all examine our saliva, right?
Absolutely.
I've never done that, and I don't think I haven't seen that in Europe. Is that something that
I'll find you a brand. Yes, I do it regularly, and it's becoming more popularized in the United States, but I will find you there are brands, in Europe that I will get you links for the show notes.
Thank you. Yeah, we can add them to the.
Yeah, but I think especially if you're into biohacking and longevity and optimization, if you're not testing your spit and looking at these pathogens and bacterial balances, I really think you're missing a huge component of your health. And so many people do blood work and so many people will test their gut microbiome, but we really need to be testing the oral microbiome too. So I personally test mine annually, just like I do blood work and other, workups on myself. And I will tell you it was a couple years ago now, but out of nowhere, I had an extremely high level of F nucleatum. And F nucleatum is a bacteria that is linked to pancreatic and colon cancer. So you best believe I proceeded with a protocol to eradicate that. And I can't tell you why they were there. It's the terrain theory. So obviously something was going on in my body that allowed them to kind of take over. I was probably run down or I just wasn't optimized in other ways. But it's a really important component. And if you're struggling from issues and you just can't figure out why, I say always look to the mouth.
Okay, and I'm just curious, how did you get rid of those
Yeah,
bacteria?
so certain bacteria, they really benefit best from pharmaceuticals, so I did take a round of antibiotics, and then which is not ideal, I know, but some spirochetes, they're very virulent, and so you can throw all the nutraceuticals and herbs at them, and you won't touch them. And so it's a risk benefit analysis for me. So I chose the antibiotics and then I followed up with rinsing with things like ozonated water and grapeseed fruit extract or grapefruit seed extract. I use biocidin a little bit that would break up the biofilm first. So there's different
Yeah.
antiseptics and antibacterials in the herbal world that can really be helpful. Oregano can be very helpful. Hypochlorous acid is another that you can use, and sometimes you rotate through with like a water pick, rinsing,
Yeah.
and then just trying to optimize myself systemically because, if you're a perfectly healthy human, these bacteria shouldn't be able to, you know, take over. So something was off in my body in other ways too. So I made sure to address it systemically as well.
So they disappear.
They're still there, but they're in a much lower percentage within normal. And the tests now that you get, they give you ranges, which is great. It shows you where you are and what is optimal and what isn't optimal.
Okay. So what about bleeding gums? What do bleeding gums really mean for the rest of your body? I heard that as much as, well, a majority of the population actually have inflamed.
Yeah, up to 80% of Americans, and that's probably translates globally, have gum disease. Um,
Yeah.
so most of us, I'm sure, have heard of leaky gut, okay, or intestinal permeability. There is the same in the mouth called leaky gums. So what does that mean? If your gums bleed, or we say pink in the sink. So if you brush and floss and you spit and there's red or pink, you are not optimized. Now, if you have an area, like one little spot here or there, I don't want people to overthink this, but really our gums should not bleed because they're a barrier into our body. So it's just like if your skin was constantly bleeding, that wouldn't be normal. It's the same with your gums. So it's their first layer of protection to make sure pathogens, viruses don't get into our body. But if they're bleeding, you've now created a way for bacteria in your mouth to get into the circulatory system, to get into the lymphatic system. And this is where they catch a free ride and end up in places like your brain or your heart or your uterus or your pancreas, etc. So having extremely healthy, firm, you know, tight gums are important, not inflamed and red and bleeding and tender. And so a lot of this is through oral hygiene practices. So I am a big fan of flossing, but it also goes beyond that. So bleeding gums can be a sign of other things in the body, like nutritional deficiencies. So we've perhaps all heard of scurvy. If you're vitamin C deficient, your gums will bleed. If you're collagen or protein deficient, your gums will bleed. Your gums need micronutrients. They need B vitamins, zinc, selenium. So again, it's all connected, right? So if you're optimized in other ways and you're decent with hygiene and you're eating a whole food diet, you shouldn't have many issues. The other thing that can lead to bleeding gums is chronic mouth breathing. And this is a major issue. So this is sleep disorder breathing or even daytime breathing dysregulation. And that can affect, I've seen stats as high as 85% of the global population has some sort of breathing dysregulation, chronic mouth breathing, snoring. There's so much sleep apnea too that's undiagnosed. But if you are a mouth breather, your mouth is not going to be healthy. And that is because when we mouth breathe, your mouth dries out. So your saliva is very protective. I want everyone to start really worshiping their spit. As weird as that sounds, it's this golden elixir in your body, and it does so much more than I think people realize. It's what carries all the minerals, the immune cells, the enzymes to keep our mouths healthy and balanced. It also hydrates, so it protects your teeth. And it does mineral exchanges, so it helps remineralize and keep teeth strong, after we eat. And so if you have dry mouth, your mouth isn't protected, you're more likely to have dental disease, gum disease, bad breath. So mouth breathing needs to be taken very seriously. And the other thing, when you mouth breathe, your mouth becomes more acidic. The pH drops. So for people, basic, chemistry, We want to be more neutral in the middle. We don't want acidity. Um, some alkalinity is okay, but you don't want to be too high in that range either. But certainly the pathogens in our body love acid. And it's acid that can cause disease, and it's acid that can cause gum inflammation too. So if you are mouth breathing, it's important to get that under control.
So why are so many people mouth
Yeah.
breathing? Yeah, because that's something I hadn't heard of like when I was a child, and now actually I see that more and more people do mouth breathe, and actually one of my children, he's 16, 17 years old, and I can see that he mouth breathes a lot, and he suffers. I mean, I can see sleeping. It's a problem.
Problem.
Why is that?
Yes. So the scientists who study this, they theorize that, in the anthropologists, that this has to do with our food and our food landscape. So if you go back about 12,000 years ago, which wasn't that long ago, really, in the course of human existence, we were a hunter-gatherer society. So we were foraging and we were chewing up to 4 hours a day, okay? So if you just mimic chewing right now in your mouth, feel how the face kind of expands outwardly. That's a small force that goes out, and this starts in infancy with breastfeeding, okay? So we have forgotten the importance of chewing. And so modern humans, with our frappuccinos and our mac and cheese and our chicken nuggets and our yogurts, we chew, they say, only about 4 minutes a day because
Wow.
we mash, swallow. And we're in a rush, right? We don't, there's no mindful eating anymore. And people will always, when I say these stats that I share, people will say, "I chew 10 minutes a day," but these are estimates in just the global population, okay? So when we went from hunter-gatherer to agrarian, we started farming, we started growing soy and corn and wheat, and then the Industrial Revolution, where we started milling and processing and making everything soft and mushy and adding sugar to everything and adding preservatives to everything, our health just tanked, including our oral health and our airway health. And so it's that lack of chewing, our faces they just weren't expanding and growing. And so this has now become epigenetic. This is going generation after generation after generation, and it's why, if you go to the Natural History Museum, go look at a skull. You will see our ancestors from 10, 12,000 years ago, big, wide jaws. The teeth are perfectly straight. The wisdom teeth, the third molars have room. And this is some of the work that Dr. Weston Price did in the 1930s and 40s, is he said, well, what has happened to the modern human? So what has happened? So this lack of chewing, and now you add environmental pollutants, so we all have allergies, we can't breathe through our noses anymore, we're chronically inflamed, we mouth breathe, it just changes the way you grow. So you tend to grow, instead of out and wide, down and long. And what happens with this is our teeth come in all crowded, our jaws are narrow, and that shrinks our airway. If your palate is narrow, the roof of the mouth is the floor of the nose. And so if it is narrow, now your sinuses are narrow. Also, if your palate becomes vaulted, okay, your septum can deviate too. So a lot of people have deviated septums. It's not because they broke their nose, it's because everything's been smushed inward and things have to go somewhere. And so people have a really hard time breathing through their nose. And this is why functional dentists, they like to do airway screenings very young in children, because if we feel the face is too narrow, we can do retainers sometimes as young as the age of 4 or 5 to start widening the face and growing the face wider. So, and this is a permanent fix, like you're changing the trajectory of that child's life. And so that's the kind of short answer. If people are really interested in this, which obviously I'm passionate about it, but the best book, and it is so well written, is called Breath by James Nestor. It will explain all of this. He does this really fascinating experiment on himself where he makes himself a mouth breather, and he talks about the health effects he felt in just 10 days. He's a scientific journalist. It's beautifully written, but I think it should be required reading for anyone interested in health and wellness because to me, we can talk about all of these things in this space, nutrition and supplements and optimizing this and that and resistance training. If you're not sleeping and breathing optimally, you will really struggle with your health because
Of course.
it's
Yeah.
about oxygenating the brain, inflammation, obviously we're talking about dental issues too. So it's something that
Even hyperactivity, ADHD, right?
absolutely there's a significant
Brain function, memory. There's so many
yes.
things really.
Yes, cardiovascular disease, I mean, challenges with, weight loss, our hormones are impacted significantly. Children who mouth breathe, you are right. So you get about 20% less oxygen to the brain when you're mouth breathing. So
See.
kids, it will display as ADHD, and a lot of kids get diagnosed with ADHD and unfortunately put on medication when really it's chronic sleep deprivation and lack of oxygen to the brain. It's an airway issue. So that is why we like to treat kids early. You'll hear people and doctors say, well, just wait, they'll outgrow it, or just wait till all the baby teeth fall out. My argument, I'm becoming really vocal about this. I think that's malpractice. What are we waiting for? If you know that this can benefit a child, why are we waiting to get that child optimized and oxygenated? Brain development, you have one chance, right, to develop a brain.
Yeah.
Uh, and things get missed, of course, but when you know better, do better, and so the kick the can mentality is really frustrating with all the science and data that we have on this now.
Okay. I wanted to jump back just a second to the oral microbiome, um, because I wanted to know if you think that decades of aggressive oral hygiene practices actually triggered like kind of a hidden epidemic of oral microbiome problems.
Yeah, yes. You're the first person that's ever asked me that. That's very thoughtful. Yes, I absolutely think so. So we've been taught, the marketing is always kills 99.9% of germs, and that was just thought of as such a good thing, but we now know better. This over disinfection, all the hand sanitizer and the bleach and we were just too clean. It's had the opposite effect. So now we have more asthma and allergies and eczema,
Right.
and it's the same in the mouth. So most of these products that have astringents and alcohols and even essential oils, these things that are just carpet bombing, they do not, it's not selective. It's not like they're just targeting pathogenic bacteria. It will wipe out your good bacteria too. When you carpet bomb your mouth, who knows what's gonna grow back? What tends to come back are the more virulent species. Those are the bad guys, right? So, a lot of times when you just completely carpet bomb your mouth, unfortunately, what comes back, to a greater degree can be the bad bacteria, the pathogenic bacteria. So, we
Right.
want to instead
It's the same when you use these alcohol, alcohol gels on your hands. Actually, you take away all the microbiome. So the bad guys, they are the one that they're more aggressive. So they
it
come
has
back.
the opposite
That's
effect of what you want it to. Absolutely.
exactly
So, yes, I agree with you, and not only that, it dries your tissues out. A lot of those ingredients are just caustic and just not healthy for the mucosa. It's irritating, can cause ulcerations. We now know that, like, traditional mouthwashes, for example, are linked to cardiovascular disease and high blood pressure. Well, why is that? Well, because there's bacteria in our mouth on the dorsum of the tongue that are responsible for boosting nitric oxide. Okay, nitric oxide is an important molecule for cardiovascular health. And if you wipe out those great bacteria that are helping you produce nitric oxide, you can have cardiovascular issues too, which is crazy, as well as erectile dysfunction. That usually gets people's attention. So we need to stop the Listerine and those strong rinses that burn. And here's the thing, I mean, if you are saying, "Well, what am I supposed to use my breath?" If you have breath that is that significantly, worrisome or offensive, and this, I'm not trying to be rude to anyone, but this is just a red flag. This is not normal. This is a red flag your body's giving you there's something going on. Your breath should be fairly neutral. So if it is very odorous, you likely have periodontal disease, you have pathogens, maybe you have an underlying infection that's getting missed. There's something else going on in your body, but again, we've just normalized it. It's like chew gum, rinse with this mouthwash to mask the issue, but the
We should look for the root cause rather than cover the cemetery. Yeah, that's very
yeah.
important. I've even heard that bacteria in your mouth can actually increase your risk for cancer. I mean,
Yeah.
those bad guys, the bad
That's
bacteria
it. Links.
can risk your. How does that relate to cancer?
Yeah, so the bacteria translocate and end up in places, let's say the pancreas, so F nucleatum, and it releases exotoxins, okay? And then so your body will be in this constant state of chronic inflammation, and eventually that can lead to a mutation. Um, yeah, so a lot of this is still in the preliminary research, but the data is there. I mean, it's concerning, especially they're doing biopsies in areas like colon cancer, and they're finding an exorbitant amount of oral bacteria in these lesions in the colon. It's like, well, and you can see that they're creating, inflammatory cells and things. It's the same in the brain. It contributes to amyloid plaques. So they're doing more studies on it, but clearly there's a correlation there, and some we're learning is more causal too, but we obviously don't need more science in this.
So you mentioned the mouthwashes but what about the toothpastes? What is in toothpaste that we should actually be avoiding? Today there are so many different kinds of toothpaste. The one with fluoride, without, and the organic ones and the natural ones.
Well, I would be cautious with the natural toothpaste, only saying they're not all clean. So we have to read ingredients, just like we read ingredients of our food and now cosmetics. You need to read the ingredients of your toothpaste and try to start understanding these ingredients, because there is some bad stuff in toothpaste. So the things I really want people avoiding: sodium lauryl sulfate. That's the foaming agent. Many of us have been trained or conditioned to feel like we need that to be clean. I don't want your toothpaste to foam. This can be really hard for people to accept or let go of, but I'm just the messenger, okay? So that foaming, it's killing your microbiome, not in a good way. And it's irritating to the gums. And a lot of people end up with chronic oral ulcerations. And so if you get a lot of oral ulcers in your mouth, I wonder if your toothpaste has sodium lauryl sulfate in it. So I would look for that. Triclosan is one. I believe that's even banned in Europe, but some of these things are still allowed in the United States. You want to be careful of strong essential oils. Essential oils are antimicrobial, okay? So they have a time and place, but I would argue for a short duration. I don't think they should be used daily, only for acute issues until the issue's resolved. Emulsifiers and surfactants, like just the gums and the additives that they put in there. Now, regarding the fluoride conversation, this is a personal choice. I personally don't use fluoride. It is considered a neurotoxin. That's more concerning systemically, I think, like with water and supplementation. But I'm a very err on the side of caution. I just try to eliminate my toxic burden as much as possible. But the other thing with fluoride that people don't realize is fluoride's antimicrobial, and it's not selective. So we are going in and killing good bacteria, but also, sorry, killing bad bacteria, but also good bacteria. And this is why I hear this a lot. Patients get off from fluoride toothpaste and they get healthier. And I think it has so much to do with their improving their oral microbiome. So fluoride will make your teeth more acid resistant. Um, that will protect it from acid attacks, but there are other things that work just as well. And the one that's becoming very popular, and I know it's becoming more and more popular in Europe too, is hydroxyapatite. So hydroxyapatite is biomimetic. Our enamel, our teeth, and our bone are made of hydroxyapatite. That's calcium and phosphorus. We do not have fluoride in our body naturally. There's no amount of fluoride in your tooth naturally.
No.
So I prefer to take a more biological approach, and so it will actually help boost the microbiome. It kind of super saturates your saliva to be more mineral rich, and it helps with remineralization. So that is my preferred active ingredient, if you will, in toothpaste. And I have found my patients that use it, their mouths they really get healthier. So that's my suggestion.
I haven't been using toothpaste for over 20 years
Amazing.
myself.
Yeah, and the thing.
I mean, what you just mentioned, the hunters and gatherers, and I believe that, I mean, 10,000 years ago, as you mentioned, our teeth were perfect, and we chew what we ate, and also we didn't eat this ultra processed food full of starch and sugar. So I mean, if you follow a diet like a paleo diet or even a carnivore diet, I don't think you need toothpaste, to be honest. I do use a toothbrush with just
Yeah.
scoop water, and I do use a water pick.
Great. I love that.
And for me that works well. I mean, I haven't had any cavities in 25 or 30 years.
I believe it, and because it is all about our diet. So you are unique, and you're committed and you're disciplined, right? And so for someone like you, I totally agree. If you're following a strict ancestral diet and you're committed to it, I agree with you. I don't think you need oral care products. I speak to the masses, okay? And so most people aren't that committed to a carnivore or paleo diet. Um, so you do you, like everyone out there listening, you know what your diet is like, but if you're sneaking in bread and crackers and chips and muffins and a frappuccino, you need to be using something, in my opinion. But if you are eating just things that come from the planet, you're probably safe. But, if you eat excessive fruit, I'm not anti-fruit by any means. I love fruit, but if you eat excessive fruit, if you eat excessive honey, maple syrup,
Or so like,
these are things that you just should be aware of. So,
yeah. Just a question when it comes to the water pick, what do you recommend using hydrogen peroxide or baking soda?
mhm.
What is of those two? Which?
Baking soda, hydrogen peroxide, it can be too much for the microbiome, so it can kill your healthy bacteria too. I think it's okay to do once in a while. I would not do it daily. For just a daily use, I prefer just water, baking soda, and a sprinkle of salt, honestly, like a low microplastic, high quality mineral rich salt can be a wonderful way to just rinse out your mouth. And I do love water picks, especially as we get older. My protocol is I string floss one night and the next night I water pick. And this is because as we age, regardless of what you do start to lose some bone. Okay. And so it becomes really hard for the floss to really clean out that pocket, which the bacteria love on areas of low oxygen. Most pathogens are anaerobes, so they love to hide between the gums and kinda down in those nooks and crannies, so that flushing is really, really important. So I do love water picking.
Okay, so when you talk about flossing your teeth, what kind of product do you use? Because most products, at least in Europe, they use fluoride, they use all kinds of Teflon. They're all plastic. What do you suggest?
The only 2 that are truly, quote, unquote, "clean" is a silk floss or a bamboo floss, and you definitely need to look too, like, are they coated in anything unnatural? Have they added flavorings? But it does exist. Like, I'm actually working on a floss that's clean. Um,
Okay.
yeah, yeah, and you can impregnate them with really cool things like bee propolis and things that can help boost the microbiome too. So, or, you can coat them in beeswax. There's certain type of cleaner vegetable waxes too, but you wanna read the ingredients and maybe even email the company just to make sure. Because 'cause you're right, especially some of the woven flosses, There's so much greenwashing in the floss industry, let me tell you. I know more about this than I should. It will say compostable, biodegradable, all natural, and then you're like, "No, there's still petroleum-based products in that." So, like, the woven floss, which mo a lot of people like, and I understand why, it cleans so well. How is it expanding and contracting like that? There's plastic derivatives in it, absolutely, and so it will say PFAS free, but it's just like how we used to say BPA free. That's great. That's just one type of plasticizer. There's many, many others. So it's kind of a marketing trick to some degree. But I use silk floss, just a plain silk. You can find it on Amazon. Um, some people will say that it doesn't work for my teeth. My teeth are too tight, and that's a skeletal issue, right? That means your jaws are too small, and so you have to decide, are you gonna use it's risk benefit. So if your teeth are crowded and you have to use this other type of floss, are you okay accepting that there might be some plasticizers in there versus getting gum disease and decay? Or do you use a water pick, or do you work on widening your jaw, which you can do as an adult. It's harder to find people doing it, but you can, without surgery sometimes. So, yeah.
So for those who eat a diet that makes them more prone to cavities, like one high with sugar, starches, or processed foods, how often would you brush your
Mm,
teeth and
yeah.
floss?
So, I generally just recommend twice a day brushing and nightly flossing. I don't like to overwhelm. I think that's kind of the bare minimum that is successful. Um, at night, I like people to floss then brush. Um, it's just loosening the food and the bacteria. You're basically, what is hygiene? It's removing the biofilm. So we're so lucky we get access to the biofilm of the mouth. You can't access the biofilm of the gut or the sinus, or so it's kind of nice. We can like loosen the biofilm and then kind of scrape it away and then brush it away more, right? And so what you're doing is you don't want the bacteria to adhere and stick to your teeth for too long, because what are they doing? They're releasing acid. So you want to kick them off. But the thing is they come back again,
Yeah.
right? So and what they feed upon are fermentable carbohydrates. So to your point, if you're not feeding your bad bacteria like fermentable carbohydrates. If you're not feeding the bad bacteria, then you are in a much healthier state. What do your good bacteria like to consume? Prebiotic fiber. So all those healthy veggies, and obviously getting in fermented
Yeah.
foods for the probiotic boost too. So it's all about what are you feeding your body, and so this is how I work with kids, and I teach the kids. I said, "Do you wanna feed the good guys or the bad guys? So if you wanna feed the good guys, you need to eat more fruits and vegetables and things of that nature too." Yeah.
Yeah. So you talk about this biofilm. What about the biofilm on our tongue? Should we be scraping our tongue? Is that a good idea? And when if you scrape your tongue, what do you use? A copper or stainless
Mhm.
steel?
So I like scraping in the morning right when you wake up. I like For me, I like how it feels, but I also think you're kind of getting the lymph flow going and just starting your day, with just a fresh start, if you will.
Do you do that every day, Stacey?
I do. I'm a pretty light tongue scraping every day. I do every morning. I mean, I'll miss a day here or there. I use stainless steel. I think either are fine. Copper is more traditional, more so this is an ancient Ayurvedic practice. Um, and what's interesting is so if this is your tongue, you have these fissures. The healthy bacteria actually like to live down in the fissure, and more like candida and some of the bad bacteria like will coat. So if you have a white coating, you probably have some sort of dysbiosis. Usually it can be fungal. And so that's what you're removing is kind of the dysbiotic bacterial biofilm. What's interesting with tongue scraping too, you'll find your palate is brighter, so you're removing food particles and remnants. So especially if you're eating ultra processed foods, believe it or not, they've done studies on this. Those food particles stay on your tongue, and they can trigger other cravings, like trigger that bliss point, that need for that fat, salt, sugar. I need to go eat more potato chips. So if you're cleaning your tongue, you're kind of refreshing the palate, so you have things will taste better too. So, yeah, but I do love tongue scraping. Um, yeah, and I would say too, going back to more optimize if you're eating a more traditional modern diet, if you could brush midday, um, and maybe add a floss in, around lunchtime, that's great. I just don't think that's realistic for many people.
Okay. So you mentioned cavities, and I have a question about. I mean, cavities. When I was a child, when you have a cavity, it should be um, we should treat them immediately. But now I hear more and more that treating cavities in children, maybe that's not a good idea. They can actually heal for themselves. Is that, how do you see that?
Yep.
What's your point?
So our teeth naturally demineralize and remineralize all day long. So every time you put anything into your mouth besides neutral pH water, so I'm drinking mineral water right now, which is closer to neutral, but it's going to be a little more on the acidic side. So my pH of my mouth just changed. So my teeth probably just demineralized a little bit. Okay. Every time we eat, digestive enzymes kick in to break down our food, the pH lowers. When the pH lowers, minerals get pulled out of your teeth. What's cool about the body is if we give the mouth a chance to rest, the pH rises again. It buffers through our healthy saliva. So this is why your saliva is so important. It's constantly buffering, remineralizing with all these healthy minerals that are floating around. And so this demineralization, remineralization process is normal and it happens all day, every day in humans. So if you get a cavity that's small, if it's still in the enamel, you have a very good chance of remineralizing it and avoiding a filling. And for me, I work with children. I have come to realize through my 20-year career that we are way too aggressive with children's dentistry. I'm the littlest cavity now is getting a crown put on it, and the child is put under anesthesia. And I wanna be very clear, this isn't to say that some cavities need to be fixed and some children do need sedation. That is absolutely true, but I do think we're over-treating so much. And every little teeny thing that's going on in a child's mouth doesn't need to be treated. And so there are protocols you can use to remineralize teeth. So this is where hydroxyapatite can come in. I really love ozonated water or gas, which your dentist would have to do, or there's ozonated oils, like they can ozonate olive oil or avocado oil, and that's antimicrobial. Some people use iodine. Um, you want to optimize the diet, make sure we're getting enough fat soluble vitamins, enough minerals, we're hydrated so our saliva is healthy. We have to get mouth breathing under control. So there's kind of a checklist, but it really works. I have an entire protocol that works at my office, and so that's if the cavities are very small. Now, if they're a little bit bigger, sometimes we can't fully remineralize them, but we can arrest them. That means freeze them. So we'll still always see them on an X-ray, but they're not growing. And to me, that's also a success. Okay. So what are we really trying to avoid? We're trying to avoid pain and infection in the child. And so if we can stabilize it, that's amazing. And then the other thing that we can do is sometimes just slow the progression. So the child's really young, they're 3, and there's no way they would sit for a fill-in. And we really don't want to do anesthesia on this child because it's just no one wants to do anesthesia, but maybe it's just a couple teeth. You can't really justify it. Let's try this. So we kick the can. We're slowing the growth of the cavity. So now maybe the child's 4.5 or 5, and they will sit and allow me to do a small filling in them. So there's all these different strategies, and But for certainly, if you see a big hole in the tooth or the tooth's infected and there's pain, that generally means more traditional treatment, and you do need to treat that.
Great. That's fascinating. So it's basically about mineralization and demineralization, and we need to help our body to uh, doing those.
Yes, that's right. There's something called the Stefan curve, if people want to look it up. We can link it in the show notes later on Stephan, and this is all about the process of demineralization and remineralization throughout the day, and this is another important point. So some people will say, "I don't know why I'm getting cavities all the time or my child is. We're doing everything right." And then I say, "Let's talk about how often you eat and drink." Okay? Yeah,
Exactly.
so just like over-consuming food is trashing our gut health, we don't give enough of a break, to allow processes to happen, the whole rest and digest. We're constantly nibbling, snacking, and so many kids just snack all day long.
How often is too often to eat if we want healthy teeth?
I want people eating on a schedule, ideally every 2 hours, and the reason is this is the optimized amount of time needed to naturally remineralize through your saliva. So, people who snack and nibble and sip all day constantly are in a more acidic stage, and they're more likely to have oral disease.
Great. Yeah. So how much damage, how much dental damage are we doing with foods promoted as healthy, like granola bars, cereals, even smoothies? If we have them all day long
Yes.
snacking.
So flour acts like sugar in the mouth. Most of us know sugar isn't ideal for oral health. And this is because these foods, they feed pathogenic bacteria. So things like crackers, chips, pretzels, granola bars, fruit snacks, dried fruit, cereals, not only are they high in either sugar or flour, but they're sticky. So it's so much about contact time. And this goes back to sipping and nibbling all day. The amount of times we eat can impact our oral health significantly, and the amount of time that food or drink sits on our teeth impacts us significantly too. So we really don't want
Yeah.
sticky foods.
So how can we retrain our brains and bodies to stop snacking constantly?
It's tricky. I think doing like switching out for similar but better snacks, you just kind of like desensitize yourself. So let's say your child's addicted to crackers, maybe would they switch to a seed cracker first? And then could you switch to seaweed snacks? And then can you move to crunchy carrots and cucumbers instead? So it can be a little bit of a transition. The best thing with kids, though, is out of the gate from the moment they're born is just trying to introduce whole food so that you're creating that palate and that healthy habit.
So uh, I wanted to ask you about white teeth. I mean, and what we just we're talking about processed foods and how often we eat, how much we snack. Does that also have to do with how white your teeth are?
Yeah, I mean, there
Do we get more stains when we snack, when we have coffee,
yeah.
tea?
Definitely coffee and tea, wine, berries, and again, I'm not villainizing anything here, certainly smoking, um, and food dyes too. I mean, what are those doing to our teeth also? So these things all compound and add up. Mouth breathing, it will change the color of the biofilm. So yes, depending on your food choices, it can alter the staining. A lot of the staining is extrinsic on the outside, so it will polish away. But bleaching is really popular now, and I understand people want bright white teeth, but people do need to understand some of these strong bleaching agents can damage the microbiome. They can damage the nerve of your tooth if you overdo it, and they can cause permanent sensitivity in your teeth too. So you just want to be mindful of the ingredients you're using.
I think sometimes we go too far. I mean, having like these super white teeth, it's not, that doesn't look
I
natural.
don't like it. It looks so unnatural to me, I know, and the thing that people don't understand, I think lay people, because we often look to celebrities, right? Those celebrities very often are either photoshopped with brighter, whiter teeth or filtered, or they have veneers. And here's the thing with veneers. So, anytime you put anything into the mouth, it shifts the microbiome, a filling, a crown, a veneer. So, you are changing the balance in your mouth. You're now creating ledges and edges for bacteria to cling to around those veneers. And veneers pop off, they fail. So, I always support people to do what makes you happy, but just make sure you understand the risks and benefits and really try to do prepless veneers, ones where they don't shave down your teeth. I see all these young people on social media and TikTok. I mean, they're just filing down their healthy teeth, and it's so sad to me. They're going to need all of those teeth will have to be root canaled eventually, and quite honestly, they're probably gonna lose many of their teeth and need implants. I mean, it's terrible. Yeah,
That's
it's terrible. So, I always tell people start with just whitening with there are more natural ways to whiten teeth. This is where you can use hydrogen peroxide every once in a while, not overdoing it, and baking soda. You can do bleach strips and things. Again, try not to overdo it because of the microbiome. So start with whitening your teeth and then consider something like, I don't know, Invisalign or something to straighten your teeth. Sometimes if you just straighten your teeth a little bit and whiten them, you'll be pleased. Try not to go aggressive right out of the gate because you could really regret it.
What about these lid fillers? Because they're really popular. How do cosmetic lid fillers impact oral health and the overall function of our mouths?
Well, this is a great question. I don't know. I have concerns with filler long term. I think this is going to be something we look back on with regret. That's just my gut. I just it's like a logical thing for me that just doesn't make sense on a biology level. I will say there if you want a bigger lip, there are laser therapies that can increase collagen synthesis, which is this is a much more natural way. So look into that. Like look into more laser therapy. Um I would worry though, like some people I've seen, the lips are so large. I do worry about myofunctional issues and breathing. Like, how are you keeping your lips closed? And I suspect a lot of these, usually women, are mouth breathing now as a result in the night. And what is that doing to your overall systemic wellness? I have concerns with that certainly.
Yeah, because that's really important, right? To have your saliva covering your teeth, uh, 24 hours, right? That's super important. Can oral health predict or even contribute to chronic diseases?
Yes, it can. This is where understanding your oral microbiome is so important in oral microbiome testing. So, test, don't guess. But if you have oral pathogens, we know that those can translocate to other parts of the body and lead to systemic illness, including Alzheimer's, dementia, fertility issues, complications with pregnancy, autoimmune disease, cardiovascular issues. It goes on and on. So it's really important to have a balanced oral microbiome.
Any exciting projects, Stacey, that you're working on?
Yes, thank you for asking. So the issue with a lot of these conversations is we speak of these things and listeners are so interested and they want that and they want to find a provider that practices this way and that can help support them. And unfortunately, many dentists are still practicing, in my opinion, in a very antiquated way. And so I'm co-founding the Institute for Functional Dentistry. So we're allied partners with the Institute for Functional Medicine, and we're getting dentists trained up on all of these things we're speaking of. So oral microbiome testing, biomimetic materials, supporting a patient's airway, how to do cleaner, less invasive dentistry, how to connect all the dots from the mouth into the body using functional medicine principles. So that's launching later this year in 2025, and it will be global. So providers from all over the world can sign up. And then we're just hoping it creates this slow movement. of practicing dentistry differently and getting the mouth back into the body. So I'm really excited about that.
That, yeah, that sounds so interesting. Staci, where can people find you?
Yeah, I mostly live on Instagram. So it's Dr_Staci. Doctor is spelled out and it's Staci. I have a weekly newsletter. So a lot of the topics we spoke about, we brush over them, but I really dig deep on a topic every week. And that's at my website, drstacy.com. I also have online consultations, and I do see people from all over the world for those consultations. I mostly work with children. That's my focus right now is starting them off on the right foot. This is preventative medicine for me is working with kids. So, and yeah, I'm on X and TikTok and everything too, but that's where you mostly can find me.
Great. Before we started actually talking, you mentioned that you were about to launch some kind of online um, sessions, or you were about to share a link with me. What?
Yeah, well, I have an oral health care line. That's oral microbiome supportive. So I do have that I can share. It's a little tricky to get in certain countries, but we could share that. But then there are courses as well on my website. We have an oral microbiome reset course, and then the other course is called Cavity Free Kids. And it goes over not only cavity prevention, but what to do if your kids do have cavities and the protocols I'd like if we think we can remineralize teeth too. And then I have a guide on my website as well, that teaches you kind of the step by step of how to address cavities if you are experiencing them. And this applies to adults too.
Thank you so much, Stacy. It's been really, really interesting. I've learned so much, as I said, and I hope we can do a follow-up session
I would love that.
in the
Yes,
future.
thank you, Nicholas. I appreciate it.
Thank you so much.
This was just one episode. There's so much more to discover. Check out the full podcast series, subscribe for future episodes, and let me know your thoughts in the comments.